Christchurch has joined the Delta Club no one wants to be a member of. 2 cases there, both unvaccinated, but for the moment it's been allowed to stay at level 2. The 2 cases are a couple from Bishopdale, where the New World is now a location of interest. The couple are in MIQ and 9 of their close contacts are self-isolating. There were 89 new cases today, 83 in Auckland, 4 in Waikato and the 2 in Christchurch. There were also sweeping changes to MIQ today, with stays halved. And from November 1st, full vaccination will be a must for all non-New Zealand citizens entering the country. Juliet Speedy begins our coverage with Christchurch finding out why Auckland's been in such a bad mood for 10 weeks.
It's early morning queues at supermarkets and testing stations. The dream run is over. Now COVID's come to town.
I'm just need to get tested since I have a sore throat.
Woke up real sick a couple days ago. Wasn't going to do much about it, but then obviously hearing about the cases today.
Toilet paper today as popular as vaccinations. Centres across the city overrun with walk-ins and drive-thrus. It's the news many have been expecting, but not welcoming.
I just thought, what else could go wrong?
It was always going to hit here at some point.
And widespread frustration that the 2 confirmed cases are unvaccinated and unwilling to use the Tracer app.
They know the rules, they chose not to do it, so I'm really annoyed.
That was the shocking thing today, was to find out that they're not using the QR codes.
No lockdowns yet, but there are already 9 locations of interest in Christchurch. Epidemiologist Michael Baker says the government and South Island leaders could and should have done more to keep the virus out.
I think there's been very mixed messages from the leaders of the South Island communities about the benefits of keeping the virus out of the South Island.
Well, I have raised the issue of the question of having double vaccinations.
There is no way of absolutely guaranteeing that we wouldn't see other cases popping up in other parts of the country.
Westland Mayor Bruce Smith has been one Southern leader outwardly calling for better protection of the South Island.
We have been failed and it's like there's no common sense in what's occurred today.
There's also fury that the government is mandating vaccines for sitting down for a flat white, but not for those travelling out of COVID hotspots like Auckland.
Why on earth are you flying people from Auckland to Christchurch?
We should see more leadership from Air New Zealand, because it is a health and safety issue for their staff and other passengers on their flights if they allow unvaccinated people.
The government says it's on their radar. National says the answer is full vaccination and rapid antigen tests for all travellers.
That could potentially have prevented these travellers from going to the South Island and taking COVID.
They're here now and isolating, but whether the virus is too is still under investigation.
Well, Juliet joins us from Bishopdale. And Juliet, what measures have been looked at to stop this happening again?
Yes, well, Mike, there's certainly outrage from many down here that this was even able to happen, namely that a fully unvaccinated person was able to fly out of a city with thousands of community cases of COVID to a city with none. Now, the government has said today, Chris Hipkins said, it is something they are now looking at, mandating vaccinations for interregional travel, particularly on flights. And we also heard back from Air New Zealand late today who say this is something they are also looking at, which is a slight change of tone from them. You'll remember Chief Executive Greg Foran saying not that long ago that it might be difficult because Air New Zealand is the only carrier into some airports. But of course, Air New Zealand is not the only carrier in this country. Therefore, for a vaccine mandate to really be effective and stop something like this happening again, it would need to come from a government level.
Juliet Speedy,
and as to whether that happens and whether it's too late for what is happening here now and whether there will be a wider community outbreak, we'll find out in the coming days.
Juliet, thank you.